everyone. You're watching CNN Philippines, and welcome to The Doctor Is In. I'm Dr. Freddie Gomez, and we hope to provide you with virtual care that we all need, especially during this time of the coronavirus. Now, we continue to deal with the effects of the COVID-19 pandemic, but we should also be watchful of other diseases, especially during the rainy season when we are more susceptible to bacteria and viruses. Now, viruses and bacteria are not only transmitted via droplets or via airborne, they can be found in the food you eat, the water you drink, or from insects like mosquitoes. So today in the program, we will differentiate or we will explain to you the difference between waterborne from vector-borne diseases and how to minimize the risk of infection and where to get optimum protection, especially this season. Joining us is Dr. Yen Reyes. She is a pediatric infectious disease specialist from the University of Santo Tomas Faculty of Medicine and Surgery. Welcome to the show, Dr. Yen.
Good afternoon, Dr. Gomez. Good afternoon, everyone, and thank you so much for having me here.
Now let's start off the discussion with vector-borne diseases because according to the World Health Organization, it accounts for over 700,000 deaths every year. Now, Dr. Yen, what are vectors? And could you please explain to our viewers what are the common diseases that these vectors bring?
Okay, so we first define what is a disease vector. So technically, a disease vector is an organism like a mosquito, which in itself doesn't cause disease. However, if it transmits virus like the dengue virus from one person to another, it can cause disease. So technically, a vector-borne disease is an inflammation which is caused by a vector or a mosquito, which wherein the virus is transmitted from one person to another because of a mosquito. An example for this is dengue. So it is very, very common, especially during rainy season because the mosquito breeds in stagnant water. So dengue is caused by a Aedes aegypti mosquito. And usually, if a person is bitten by a mosquito, uh, there will be a dengue. So the person will usually have fever, usually 2 to 7 days duration, associated with headache. Some have bleeding from the nose, bleeding from the mouth, severe muscle pains. Some will have vomiting, and some will also have diarrhea.
Okay, so sabi nga ni Doktora kanina, kasama sa tinatawag na vectors ang lamok na Aedes aegypti na nagdadala ng sakit na dengue. And almost 4 billion people globally are at risk of contracting dengue. Kaya palaging paalala ng Department of Health na gawin ang 4S strategy para maiwasan ang dengue. So now, as restrictions ease and business activities resume, more people go out, which increases the exposure to vectors, ika nga, that carry diseases like dengue as well as malaria. At idagdag pa natin dito that our healthcare system is still overwhelmed with an increasing number of cases due to COVID-19. So my question for you, Dr. Yen, is what measures should we do or what measures can we do in order to avoid getting infected?
Yeah, so it's true. We really have to follow what the DOH said. We have to search and destroy the breeding sites of the mosquitoes. So whenever possible, whenever there's rain, we always have to clean our gutters so that the water can flow freely. And if we have flower pots and there are water there, yung mga tires na naka-open lang, we have to dapat itaob natin at saka yung mga alulod, we have to clean it so that we can avoid the breeding sites of the mosquitoes. And sometimes, even in my patients, I even have a patient who had severe dengue last week, and luckily the patient survived. The patient don't have a blood pressure anymore. Don't have blood pressure anymore. So even if your house has screen, you always have to kill all the mosquitoes, and then you have to make sure that you have to wear protective measures like long sleeves or you have to cover your the exposed parts of your body.
That's right. So as pretty much dengue is actually hindi lang during the rainy season pero year-round na rin. Kaya dapat hindi kalimutan ng mga viewers natin na meron pa rin dengue to watch out for. Now let's pause for now to answer some questions from people who are at home. We have a question from Michaela Alfonso. tanong ni Michaela, are all vectors carriers of infectious diseases? Ano sa tingin niyo, Dr. Yan?
So technically, if it is a disease vector, like mosquitoes, they carry infectious diseases. So if it is a mosquito, there are other mosquitoes like the culex. It causes Japanese encephalitis. So other mosquitoes also carry the mosquito like Anopheles. They cause malaria. Although we are so lucky now, or technically in the Philippines, there are only four places with malaria, like the Palawan, Occidental Mindoro, Sultan Kudarat, and Sulu. So technically, not all mosquitoes carry all the. It is just a specific mosquito like the Aedes aegypti or the Anopheles mosquito for the malaria or the culex for the Japanese encephalitis. Not all mosquitoes can carry or can have the virus itself or can transmit the virus from one person to another.
May isa pang tanong tayo, galing naman kay Ivan Dionisio. Do vectors only bring diseases during the rainy season? Magandang tanong yan.
No. So technically, although there are a lot of mosquitoes who breed during rainy season because there's a lot of water and stagnant water wherein mosquitoes breed during rainy seasons. Last year, we have dengue all throughout the year. We have a lot of dengue for January. So just as long as they can see any stagnant water, clean stagnant water, the mosquitoes will breed there. So in the Philippines, it happened last year that the dengue was all throughout the whole year.
That's right. So overall, basic pa rin kalinisan ang napaka-importante. Dapat malinis po ang ating kapaligiran. Na isa sa madalas na problema tuwing tag-ulan din ay ang water contamination. So let's talk more about this and other waterborne diseases when the doctor is in returns. Stay tuned to CNN Philippines. Welcome back to the Doctor's In on CNN Philippines. I'm Dr. Freddie Gomez. Napaka-unpredictable ng panahon ngayon. So the rainy season na, pero minsan maaraw pa rin. But there's one thing that remains the same. We need to safeguard our health no matter what the weather is. So before the break, we talked about vector-borne diseases. Ngayon naman, pag-usapan natin kung ano-ano ang mga water-borne diseases. Joining us is Dr. Yan Reyes, an infectious disease specialist from the UST Faculty of Medicine. Dr. Yen, ngayon tag-ulan, hindi mawawala ang mga sakit galing sa marurumi o kontaminadong tubig. What are these waterborne diseases? Paano ba ito nakukuha ng tao?
So in the Philippines, we have a lot of waterborne diseases. Number one of which is diarrhea. So we have diarrhea, typhoid fever, and we have cholera. So we can get it through drinking contaminated water. So we can also, it's not just the water, it can also be due to the utensils, yung baso natin, baka hindi natin nalinis, o kaya yung fork and spoon na hindi natin nalilinis. So marami pang mga diseases na nakukuha through water and food na secondary to contaminate, due to contamination.
That's right. So the lack of clean drinking water for that matter, can be the source nitong mga waterborne diseases na ito. And millions of Filipinos lack even a basic drinking water service. And at least 2 billion people utilize a drinking water source that is highly contaminated. So kasama na doon ang mga deep wells. So kanina pinag-usapan natin kung ano ang vector-borne diseases. Paano naman natin ngayon malalaman kung ang sakit na nararamdaman mo ay water-related? Ano ang mga common indicators nito, Dr. Yen?
Usually, pag mga waterborne illnesses, dahil nga contaminated water mo siya naiinom, so like diarrhea, or you have diarrhea and sometimes vomiting. So most of the time, diarrhea ang usual presentation. But you also have to be very careful because hindi lang kasi yung diarrhea. A lot of patients also die of diarrhea secondary to dehydration. So other diseases that can be caused by waterborne illnesses are the typhoid and cholera, which can also through drinking water. And others are through skin contact, like when you walk through the baha, maglalakad sa baha, na yung water is contaminated with rat urine, pwede ka magkaroon ng leptospirosis. So you always have to be very careful that you have to drink clean water and make sure na kung you wear your boots if ever you really need to dadaan kayo sa baha to prevent leptospirosis. Kasi for a time, nagkaroon tayo ng increase of incidence of leptospirosis in the Philippines. Pero although technically the most common waterborne disease in the Philippines is really diarrhea, and you really have to drink the oral rehydration salts immediately once you have diarrhea to prevent dehydration.
That's a good thing that you mentioned that, Dr. Yen, since you mentioned diarrhea ang common factor nito. Kailan malalaman ng ating mga viewers kung kailan sila pwedeng mag-treat o manatili sa bahay para i-treat ang kanilang diarrhea, or they need to go to a hospital for possible fluid replacements? Anong mga senyales, anong mga signs ang dapat nilang i-watch out for para malaman nila na, oops, medyo delikado na to, kailangan ko nang pumuntang ospital?
So as much as possible, when you have diarrhea, so like for example, water na yung stools mo, you're losing water, electrolytes like sodium and potassium. So you have to make sure that you have to drink oral rehydration salts. But you can still do it at home just as long as you don't have the signs of dehydration. So these are the signs of dehydration that you have to take care. So if your eyes, kung wala na siyang tears, dry na siya, dehydrated ka na. If your lips is also dry, tapos yung tongue nyo dry na siya, tapos sunken na rin yung eyeballs nyo, dry na siya. Tapos you have to check your skin pinch. Kung hindi na rin siya kung hindi na siya moist at dry na siya, you are already dehydrated. So you really have to go to the hospital because of that. So some kids also, they are sobrang irritable, and sometimes they are already super thirsty. So it is also a sign of dehydration. So in the home, so you can, since we are in COVID situation now, you can still use the oral rehydration. You can make use of 1 liter of water, 6 teaspoons of sugar, and 1/2 teaspoon salt, and you can use it to replace the water and electrolytes to prevent dehydration. But if you already have the signs of dehydration, make sure that you already have to go to the hospital.
Very good advice. Now, meron tayong mga tanong from our viewers, which we are very happy to have. So please continue sending in your questions via the CNN Philippines Facebook page. Our first question is from Shia Rodriguez. Bahain po ang aming lugar. Does that mean we are at risk of getting diseases like cholera?
So technically, you can only get cholera once you drink contaminated water. So just make sure that you drink clean water so you won't have that cholera.
Okay. Here's another question from Matthew Angeles. Ang tanong niya ay may kinalaman din sa baha. Ang sabi niya, ano po ang gamot sa leptospirosis? Yan, you mentioned that a little bit kanina, Dr. Yan.
Technically, so we don't usually say it because you're not supposed to buy it. So it has to be prescription based. So we don't usually say it because you're not allowed to buy it. You have to go to the hospital.
Doon is magpatingin sa doctor.
Yes, magpapatingin ka doctor. If you have other symptoms like you already have jaundice, you have fevers kapag naninilaw ka na, tapos meron kang history na naglalakad ka sa baha, tapos meron kang sugat, tapos meron kang fever, tapos naninilaw ka na, tapos minsan ang iba nag-diarrhea, minsan ang iba vomiting, you have to be checked by a doctor. You're not allowed to self-medicate with leptospirosis.
Yes, that's very true. So I apologize for interrupting you there. But definitely, magpatingin po sa doktor. Huwag po tayong magsa-self-medicate at huwag tayong basta-basta lang bibili ng gamot para inumin. Very good advice, doctor. May isa pa tayong tanong galing kay Martin Moreno. Ang tanong ni Martin, is there a vaccine for typhoid fever?
Yes, there is a vaccine for typhoid fever. We usually give it to children 2 years old and above because that is the time that they they eat contaminated foods and minsan nag-nail biting na sila, so it's possible nakakain sila ng contaminated water and food. So we give that vaccine intramuscularly. I always give that to a lot of my patients. There is a vaccine. You can go to your private doctor for that.
Okay, and before I let you go, Dr. Yen, do you have a brief message for our viewers on what to watch out for during this rainy season?
Okay, so since this is a rainy season, we have a lot of vector-borne diseases. So you just follow the DOH advice, search and destroy the breeding sites. You have to make sure that we don't have mosquitoes anymore. Well, wear self-protective measures like pants and long sleeves, and seek early consultation if you have fever, and then say yes to fogging if it is important. And then for waterborne diseases, just make sure to drink clean water and make sure that your utensils, yung baso, yung fork and spoon are very clean, and have a clean environment, and be sure to always poop in the proper place, and you're not allowed to poop in the seashore or anybody else. And I'll also take this opportunity to tell you that we still have a lot of COVID cases, and please wear masks, have social distancing, and drink clean water every day. And stay safe, everyone.
Thank you very much, Dr. Yan, for shedding light on this topic. Now, your health and your family's health should always be the topmost priority during this time. When we come back, we'll give you tips on how to stay healthy during the rainy season. We'll be right back here on The Doctor Is In. I'm Dr. Freddie Gomez, and welcome back to The Doctor Is In. We are live on CNN Philippines Free TV and on Facebook. Now, the rainy season has its charms, but it also has its dangers. Luckily, there are precautions we can take to keep us safe, dry, and healthy. So today we are joined by Dr. Karin Garcia. She's a family medicine doctor and vice president of the Philippine Academy of Family Physicians. It's good to have you on the show, Dr. Karin.
Good afternoon, Dr. Freddie. It's my pleasure to be here.
Now, Doctor, we've heard a lot about vector-borne and water-borne diseases in today's episode. Napakahirap i-handle na mga sakit na ito, lalo na ngayon na may pandemya. So, it's best that we talk about prevention and how to prevent contracting these diseases. Let's start with vector-borne diseases. What can we do to avoid these?
Yes, thank you, Dr. Fred, for that question. Very important question. There are actually simple measures that we can instill for yourself, for your family, and the community. Most of all here, okay, is actually to control the spread of that disease. And we're talking about vector-borne diseases. So mosquitoes in general. So how do we do it? Controlling the insects outside of your homes. Okay, so first step here is actually trying to remove standing water where mosquitoes could lay their eggs. Okay, and if possible, we can at least clean or empty those containers, their planters, the gutters in our homes, so that at least once a week, no, para medyo mabawasan yung water doon na naiipon and where mosquitoes would actually lay their eggs. Okay, so for yourself, it was mentioned earlier that it's advised to wear long sleeves, long pants. Okay, sana yung light colored as well, because it was proven that mosquitoes are most attracted actually to people who are wearing dark clothing. And insect repellents are also advised that we can use. We just need to follow what is in the product label as to when to apply and how to reapply. And additional for the homes, screening, okay, your screen doors and your windows is advised. And lastly, if it's possible to have those indoor plants that can actually prevent mosquitoes from bearing. So these are your citronellas, your marigolds. So those are good safety measures to help the spread of these vector-borne diseases.
Okay, those are good tips with regards to para makaiwas sa lamok. And can you share some tips naman on how we can protect ourselves from waterborne diseases?
Okay, so marami ding mga safety measures for waterborne diseases, but I think I will focus on two of the most important and significant. First of all is really practicing of good personal hygiene. Okay, so when I'm talking about frequent hand washing, and the question here is when? Kailan ba talaga dapat? No, actually anytime, but most especially after using the toilet. Okay, and if you are actually changing diapers of your children or assisting a child going to the toilet, it's advised to really wash your hands before and after tending to someone who is actually ill of this diarrhea that's because of waterborne illnesses. Okay, so also it's advised that we're used to bringing gadgets inside toilets, and kung pwedeng maiwasan yun because we'll never know what these gadgets what you can get from the toilet and bring out. Yeah. So second advice would actually be drink water, drink clean water. Okay, so we know that there are private water supplies. The suppliers, they really do tend to clean our water. But for those who do not have the access to clean water, then advised to do boiling, running boil for at least 1 minute. Okay, allow to cool, then drink waters. So probably in addition, Dr. Fred, no, for those who have access to pools or the lakes, yung mga nasa bay or nasa ilog, hindi talaga advice muna na after raining go swim, do not drink those water from the pool. It's not advised. And even if you are experiencing diarrhea, make it at least 1 week before you go swimming. Okay, so I think these are some safety measures for us to prevent the spread of these waterborne illnesses.
That's right. So aside from that, also in order to fight these diseases, we need to boost our immunity. Can you give us some tips, Dr. Karin, on how our viewers can have a strong immune system during this season?
Yes, so of course it's still healthy diet, healthy lifestyle. Okay, eating the nutritious food, doing exercise, even in quarantine. Dr. Fred, we can actually have some home-based exercises. We do not forget this. Stay hydrated. Okay, drink lots of clean water. Get adequate sleep is one. Okay, these are things that we can control. And if in order to prevent, there are actually vaccines that are available for waterborne illnesses that we can have. Okay, if we have the chance, even for the children, most especially. And again, supplements. Okay, that will help strengthen our immune system. Thank you.
Right. So tandaan din natin that these immune-boosting foods and vitamins need not to be expensive. So marami sa mga pagkain na ito ay mabibili sa local markets o kaya ito ay pwedeng itanim sa bakuran ng inyong bahay. Now let's answer some social media questions sent by the CNN Philippines Facebook page. Okay, meron tayong tanong dito. Nakakatulong ba ang water therapy tuwing may lagnat?
Yes, yes. Tama po yun. Adequate amounts of water, even though you don't have illness, walang lagnat, or lalo na pag may lagnat, at least get 8 to 10 glasses of water a day, no? To boost yung hydration natin, pababain yung lagnat.
Okay, very good. We have another question from Marga Villanueva. Any particular fruits that we can take to boost our immunity? Ayan, anong paborito niyong prutas, Dr. Karin?
Ay, nako, marami po. Pero generally, all fruits naman are healthy. In moderation din naman yan, no? But of course, evidence will tell us yung mga citrus foods, okay? Those are rich in vitamin C, those which contain vitamin A, okay? So yan, yung mga prutas, bananas, as you're showing, mangoes, your oranges, your pineapples, these are proven immune-boosting fruits.
Okay, I think I lost I think I lost a feed from Dr. Karin, but she was mentioning about kung ano mga prutas ang mga sustansya and what can boost your immune system. And it's pretty much any fruit there, any citrus fruit that you can. Hindi naman kailangan mahal na prutas, hindi kailangan exotic yung prutas to be able to boost your immune system. Okay, I think Dr. Karin is back.
Yes, thank you.
Are you
Hello.
back with us, Dr. Karin?
Yes.
Okay, that was a very good question. Now we have a last question before we go. We have a question from Aaron Hizon. Tuwing tag-ulan, safe bang uminom ng tubig na galing sa gripo?
Okay, so again, you have to make sure that the water, the supply of the water is really treated. Okay, sana po kung sa gripo i-boil na lang po muna natin, no, just to be sure, no, kasi it's advised at least 1 minute run boil your water. We'll never know kasi what contaminants are there. So in order to be on the safe side, okay, iwasan mo muna yung diretso sa gripo. If it's not, if hindi mo maiwasan, then at least boil the water, the proper boiling. No? Yun po siguro ang advice ko, Dr. Fred.
Very good, very good. And thank you very much, Dr. Karin Garcia, and to our viewers for joining us today. We hope you learned something from our discussion. But just remember, while the rainy season may have given us a relief from the heat, it also brings with it a lot of diseases. So make sure to be aware of your surroundings and remember our tips on how to stay healthy during this time. I'll see you again tomorrow at 3:30 p.m. for your next consultation. I'm Dr. Freddie Gomez. Stay safe, everyone.